Welcome everyone, and thank you for joining us this evening for the My IBD Learning webinar series. Today's webinar will be focused on back-to-school accommodations for children and teens with IBD, and we will be learning about the accommodations that parents can request for children with IBD and the process for requesting accommodations, hearing from two caregivers about their experience navigating setting up accommodations for their children, and finally share some resources that are available for parents of young IBD patients. My name is Jackie Park, and I am a sophomore at the University of Utah and the co-chair-elect of the Crohn's and Colitis Foundation's National Council of College Leaders. I was diagnosed with indeterminate colitis in January of 2020 when I was a junior in high school. Through my experience, I was so fortunate to have a great disabilities counselor at my high school who helped me through every step of the accommodations process, both while I was a student there and when I started college. I became involved in the foundation in 2021 when I joined its council, and I've loved every experience that has come along with this work. Understanding what's offered to you as a student with a disability was so important in facilitating my transition to college, so I'm pleased to be facilitating tonight's program. The My IBD Learning webinar series features different educational topics throughout the year. We invite you to review the Foundation's upcoming My IBD Learning webinars and personal regional events at crohnscolitisfoundation.org/myibdlearning. A few housekeeping reminders before we begin. This program will be recorded and accessible to view after the completion of tonight's program. If you have questions for our presenters during tonight's program, please enter them in the Q&A box. We'll try to get to as many as possible. If you're interested in live closed captioning, there are two ways you can access it: by clicking on the CC button on the bottom bar and click on Show Subtitles. If you don't see that option, you may need to download the latest version of Zoom. This webinar activity is generously sponsored in part by sponsorship from Takeda. Additional support is provided through the Foundation's annual giving program and donors. Now, I would like to introduce this evening's expert and panelists who we will be hearing from tonight. Jennie David, PhD, is a psychologist in the Division of Pediatric Psychology and Neuropsychology at Nationwide Children's Hospital. Dr. David is a pediatric IBD psychologist with the Inflammatory Bowel Disease Center within the Division of Gastroenterology, Hepatology, and Nutrition. We'll also be hearing from two parents of children with IBD, Rachel Peterson and Tracy Bolander. Thank you all for being here today. At this time, I'm going to pass it over to Dr. David, who will be presenting on school accommodations in IBD.
Thank you, Jackie. Happy to be here. All right, let me share my screen and then we will get started. All right, so thank you for that warm introduction, Jackie. Like Jackie mentioned, I'm a pediatric IBD psychologist here in Columbus, Ohio at Nationwide Children's Hospital. I myself live with Crohn's disease and have for the past, about 20 years. So a lot of middle school and high school and college and graduate school. And so similar to what Jackie was sharing, a tremendous amount of appreciation for these accommodations and also wanting to make sure that all of our young folks living with IBD have access to this as they move forward. I have no disclosures to report, and again, I'm thrilled to be here. So as a quick overview of what we're going to be talking about this evening, we're going to be thinking about school accommodations, primarily in kind of the K through 12 setting, but we can certainly talk more about things in the college and graduate school setting for folks that are navigating that, as many of us do. And we'll also primarily be thinking about school accommodations within public school settings, but again, can also think about accommodations in other diverse educational settings that our young folks may navigate through. We'll be thinking about IEPs and talking about what that stands for, what that means, 504 plans, thinking about some of the common accommodations that our young folks with IBD often have, how to do this and how to put this in place. And like Jackie mentioned, we'll hear from our parent experts in a little bit as well, thinking about how do we talk to our young folks about school accommodations, and then finally talking about some tips and tricks and things to keep in mind as we move through these processes. So 504 plans, we talk a lot about this here, and I'm sure at many other centers across the country. 504 plans comes from the Section 504 from the Americans with Disabilities Act, and is a really wonderful kind of broad legal umbrella that protects our young folks with IBD and other medical needs and behavioral health needs to get what they need in the educational settings. In general, I think about these accommodations for young folks where there's a medical indication like inflammatory bowel disease, like type 1 diabetes, like celiac disease, when there's not a direct impact on the child's learning and ability to be successful in the classroom. This really helps to protect the young person and their learning experiences and make sure they have access to accommodations. If there's ever a prickly teacher or a substitute or something else that's happening, we want to make sure that our young folks are protected. And again, we'll think more about what those accommodations can be. We'll also think more about this together this evening as well. This is strongly, strongly recommended, even when your young person is feeling fantastic and in clinical remission. We sometimes talk about this like an insurance policy and can be a really useful thing to have in place and can be helpful for other types of things that come during the educational season, like college prep testing and that transition to after high school. And a note here, and this will be true for next slide as well, even if your child already has a 504 plan, maybe they have another chronic illness, maybe they have ADHD, accommodations can be added for IBD to make sure their 504 plan is robust and accurately reflects all of the accommodations that a young person may need. An IEP is an individualized education plan. This also has a legal foundation from the Individuals with Disabilities Education Act. Unlike a 504 plan, IEPs rather can be particularly useful and advantageous for young folks when there are medical accommodations, and there also may be an impact on learning. So today in clinic, we saw a wonderful, wonderful mature young man who has dyslexia and some learning differences. He also has IBD. And so he has an IEP for his family, did what they needed to do to make sure that his IEP also accommodated his IBD accommodations as well. Similar to a 504 plan, this protects our young folks to make sure they have access to accommodations throughout the school year. And again, strongly recommended when folks are in remission. And we'll think a little bit more about how do we talk to our young folks about that when people might be like, I'm feeling great, I don't need that. And also still might be very helpful to have in place. So here's a list of some common school accommodations. In general, accommodations should be and can be highly personalized and tailored. And so this is just a jumping off point. And oftentimes when your local IBD center might give you a letter, which we'll talk about in a moment, these might be some of the things that are on there. We want to make sure that our young folks with IBD have unlimited bathroom access. I've been hearing lots, as I'm sure other folks have as well, about different types of rules that can come in place into the school setting. A young person shared with me recently that her school now has a system where you scan a QR code and have to complete a survey before you use the restroom, which might be complicated for a person with IBD. Another young person who shared that there's a cap that they can only go to the restroom allegedly 3 times within like a semester. And so we want our young folks to be able to have unlimited bathroom access and bypass some of those rules. We also want to ask for stop the clock testing. So if a young person has taken a test or an exam, being able to use the restroom without losing time. So if they use the restroom for 5 minutes, they wouldn't lose 5 minutes in the test because they were in the bathroom. They would come back with the same amount of time that was on the clock when they stopped the clock to use the restroom. Access to water and snacks, that might be during classes, that might be during tests. Access to medicine that they may need. This often also requires a letter from the prescribing physician talking about the medicine, the dosing, and any other indications to make sure that it can be given safely and stored safely in the school setting. Making sure that folks have some extra bonus time to make up tests and assignments, especially if they're coming back from a hospitalization or a surgery, you might need some of that adjustment time. Having excused absences when the time away from school was related to their IBD care, be it an infusion, or a visit with their IBD psychologist, or learning how to do humor and having an injection teach, making sure that those absences don't count against the young person. And typically this is best served when we have medical documentation that says like, yep, Bobby was out and he's back now, to make sure that the school has everything they need on file. For some schools, they won't allow folks to participate in after-school activities if the person has missed the school day. But if this is a young person with IBD going for a routine follow-up visit or it's an infusion day, we want to make sure that they still have access to those wonderful after-school activities, even if they've been absent that day. Preferential seating can be particularly useful. That way folks can sit near the restroom or like near the door to get to the restroom. So it causes the least disturbance and might also be the most socially comfortable to use the restroom during class. And then one of the last common accommodations is having an extra set of textbooks. Sometimes lugging things around can be a lot, especially if there might be other extraintestinal manifestations of of joint pain or arthritis. And so having some textbooks, both in the class setting, but then also in the child home or homes plural, can be useful to make sure they have access to those types of things. All right, so how do we talk to our young folks about school accommodations? In my experience, both as a person living with Crohn's disease and as someone who is routinely humbled in talking to young people with IBD, a lot of people can have a lot of thoughts and feelings about having school accommodations. I often hear folks say like, but I feel fine. I don't want my teachers to know. I don't want my friends to know. I don't want to feel different. And those are all really legitimate things to be thinking and feeling. Being able to open up the conversation, sharing some of this information with our young folks of, this is a really helpful insurance policy. We would much rather you have it and not need it than need it and not have it. I can speak in my own experience, both like personally and professionally. IBD can be really complicated and really unexpected. And especially in college onward, and we know here we're focused more on K through 12, accommodations really only protect folks prospectively and can be really prickly and difficult to put in act retrospectively. And so we want to make sure that folks have what they need. But being able to normalize, you might have a lot of thoughts and feelings about this. We're trying to do what's very best for your medical care, for your education. What are you thinking and feeling? Let's talk about it. And that probably will be an ongoing conversation. And you might notice that it kind of ebbs and flows depending on what's happening in the school year. If there's lots of tests, if this is the first year they're taking AP exams, if they're thinking about college, so we can kind of meet folks where they're at. A lot of the young folks that I work with have really enjoyed having a code word or a code gesture or some other type of like low-key way of saying to an adult in the room, I gotta go right now. We know that when young people are having lots of symptoms and under physiological stress and or emotional stress, it can be really hard to calmly string together words of, I have to use the restroom, I'm gonna head out now. And so having a code word that could be something like watermelon, it could be unicorn, it could be like a funny gesture that they do that tells the teacher or someone else in charge, I'm gonna use the restroom and I will be back, can be a way to retain the person's autonomy and still allow them access to the restroom. One of the common things that we were alluding to a few minutes ago is, what do I say if a kid asks, if another teacher asks? I know I certainly had substitute teachers who were well-intentioned in high school ask, gosh, like, why are you using the restroom? What's happening? And spending a moment practicing, what do I want to say to a curious peer or teacher? We might say, I appreciate you asking. My teachers and my families are helping to make sure that I take care of my body and do well in school. Let's talk about the soccer game. Let's talk about the new trend on TikTok, whatever it might be, to help kind of shift the topic elsewhere. And similar with teachers that may practice a response of, thanks for asking. Please feel free to talk to the guidance counselor so that the young person can kind of be prepared depending on who they want to tell and how much they want to say. You may also notice that evolves throughout the year and throughout the years that the person is in school. And like we were saying before, continuing the conversation with families and with kiddos throughout the school year and to check in about, how is this working? Is the code word working? Do we need to switch it up? Do we need other accommodations? What's happening to make sure that we meet folks where they're at? So how do we do all of this? How do we put it in place? So first, talk with your child's IBD team to make sure you have the right documentation. There's some really wonderful templates, including from the Crohn's and Colitis Foundation, that help to walk through the types of things that letters are helpful to have. So we want to have your child's name and their date of birth, what their diagnosis is, and some recommended accommodations. And that can be from the slide that we were showing before about some common accommodations. Typically in letters that I write, I'll write a sentence about accommodations may include but are not limited to, and then list all of them to make sure that we're keeping the door open for other things. Once we have the medical documentation, then we can go to our school. And like Jackie was alluding to with the disability, I'm going to get the term wrong, Jackie, you can correct me later, the disability accommodations person in the high school setting. Different schools might have different folks. So for some folks, it's our guidance counselor. For some, it's someone in the administration. Asking who is the best person to bring this to and making sure that person has it in hand can be tremendously useful. We'll talk about this in just a moment as well. With school accommodations, things are pretty old school. Things need to be written. Talking about it is great, but we want to make sure there's a written record to protect the child and protect things moving along in a timely way. So reaching out to that person, making sure that they have the documentation. It can often be really helpful to have an extra copy for yourself. I usually send folks 2 to 3 copies, depending on how many caregivers there are in the family, of here's one for your records, here's one to bring to school. And then within 30 days, the school has 30 days to respond after being given a written request. Then you'll meet with the 504 coordinator, whoever that might be at your child's school, and talk about the plan. You'll be able to collaborate with the educators, with your child, with other people in the family, with our core teacher, to make sure that everything is captured there, and then to finalize the plan. And then updating it every year. This can be particularly helpful as kids get older and needs and activities may change. Maybe they weren't in soccer last year, but now they play soccer for the school. It can also be really helpful to do as folks move either within the same school district or change school districts, to make sure that their 504 or IEP follows them as they continue to advance in school. And then, like we were mentioning before, once things are in place, we can always update as needed. So for some of the folks that we see who are diagnosed in the middle of the year or towards the end of the school year, we can totally still do accommodations then. And in some ways, it can be really advantageous to do it as early as possible. That way we can start the ball rolling so the next year can be as smooth as possible. So some tips for success with 504 plans. This also goes for IEP plans as well. Plan to keep track of everything that happens, and writing things down can be really helpful. Life is busy, and so we want to write things down for our own memory. But again, it can be very helpful for that timeline and making sure that things get done in a way that is supporting and protecting our kids. And so writing everything down, keeping extra records, be that like asking for photocopies, taking a picture on your phone to make sure that you've got the action steps and who's responsible. Is it a step that you need to do? Is it a step that you need from your physician, the guidance counselor? Making sure that everything is written, like we've been emphasizing, is tremendously helpful. If you ever do have a verbal conversation, as one does with, your kiddo or the doctor or someone at school, it can be really, 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 really useful to send an email to say, hey, it was great to run into you today. These are the next steps. This is a summary of what we talked about verbally. That way it's like written down. And if there's any like dates or action steps, it can be a helpful timestamp and leave that documentation trail. Like we've been talking about throughout this presentation, we really want to make sure that our plans are personalized to the folks that we have. Maybe they need different accommodations when we're doing online learning, if that's still an option through their school systems versus in-person classes. Some schools usually have a standardized 504 plan, and that's a wonderful starting point. It's also okay to mix things up. We want to make sure that things are as tailored and evidence-based for our kids as possible. Covering as many areas as we can. Again, we think about this like an insurance policy. So we'd rather have it not needed. Does your child need extra accommodations for a school trip? Do they need extra ostomy supplies or extra underwear stored safely somewhere in the school? And be as specific as possible. Like we've been talking about, if there's any extracurriculars, be it theater or band or sports, we want to make sure that they have all of their bases covered, even if it's a little bit to be determined. Maybe our child is trying out for something, but maybe we include in there, if my child plays sports through the school, these are the things that they should have access to. And for those standardized tests, like we've been alluding to as well, like the ACTs or the SATs, or if your child's taking AP or IB classes, when possible, having teacher or staff names attached to specific items, either in the 504 plan or in the action step, can also help keep folks accountable and make things clearly delineated for everyone involved. And these are also good rules of thumb for accommodations in college and graduate school as well. And then lastly, some final things to remember. We know that a lot of folks can have a lot of complicated feelings about having accommodations and having IBD, let alone having IBD and accommodations. Keep the lines of communication open. I often find it tremendously useful to approach it from a place of neutrality. For people who know me and work with me, they know that I often will talk about thoughts and feelings. And I think that's true. It captures a lot of it, and then we can kind of meet the child routine where they're at and follow their lead. And so framing it like that, you might have a lot of thoughts and feelings. How can I support you in this moment can be helpful. Stay involved in the process. It's okay to follow up. We know that our schools are busy, our teachers are busy. Some gentle prompting is always really, really helpful, and totally okay to also involve other people that you trust in the process. I've had a lot of success with being an extra heavyweight for our families navigating this, even if I'm just echoing what the caregiver was saying. Sometimes having a PhD and being part of a hospital can add an extra gravity and can move things along for a family. So use your network and use your child's advocates. Again, schools have 30 days to respond, and so be thoughtful about the time. It's okay to set a time reminder or a calendar alert in your phone to make sure that things are moving along. We want to make sure that these are reviewed and updated as relevant every year and follow kids as they move through school systems, again, even if they're in remission and feeling fantastic. And then continuing to think both with our young people and with our teachers about how is this working? How might we need to be flexible and adjusted to make sure our kids can both be medically successful and academically successful and also enjoy their time at school. Thank you so much for paying attention, everyone. I will hand the mic to the next person.
Thank you so much, Dr. David, for that informative presentation. Now we'll hear from two parents about their personal experiences navigating accommodations for their children. We will hear from Tracy Bolander and Rachel Peterson. With that, Tracy, I'll pass it over to you.
Okay. So hi, my name is Tracy. My daughter Cordelia was diagnosed, her journey started in preschool. She had just turned 5 and started to get sick. We didn't know what was going on. We met with a doctor and we started the process of finding out what was wrong. And during the summer between her preschool year and kindergarten year, she was diagnosed with Crohn's disease. And we started the process of medication. As a teacher, I knew we had to have something in place for her when she started kindergarten. So I met with the principal over the summer and said, okay, this is what's going on. I need, who's the 504 person in our school? What do we need to do? And at that time, it was the school nurse that did the 504 coordinating for her school. So before she even started school, I met with a nurse and we set up her 504 plan, met with a teacher, and came up with what we thought at that time that she would need. I also had a brochure from the Crohn's and Colitis Foundation about some possible accommodations that were needed for school. So for her to start, when we started, she had unlimited access to the bathroom, and we were lucky enough that her kindergarten classroom had a bathroom in it. She also, if she needed privacy, she could use the school nurse, her bathroom, as well as the office bathroom. So if she wanted privacy and didn't want anyone around in the classroom, she could go use a private bathroom. If there was going to be a test that they needed timing on, at that age they didn't, but they would stop the test and allow her to use the bathroom. She also had access to a heat pack whenever she needed. She would go to the nurse's office, heat it up. She knew exactly what to do and take it back to the classroom. As she got older, they provided a microwave in the teacher's classroom, so she didn't even have to leave. She could just go heat it up, come back, put it on her stomach if she needed. There were times where she got tired and needed to rest, so she had access to go rest whenever she needed. Her kindergarten year was hard. She was in and out of the hospital. So then the principal was like, okay, let's make this accommodation. The next time she's in the hospital, we'll provide a sub for her teacher in the afternoons. So her teacher would come to the hospital and do one-on-one tutoring with her, so she wouldn't miss what was needed for her learning in kindergarten. She is now a part of those 504 plans. She will talk about what she needs if there's a change. She has been a part of the leadership team at her school, and they meet after school. And there's been several times where she's had an infusion, so she had to miss school. And they have no problem with her coming in after school to be a part of those meetings and participate, so she doesn't miss out on anything. One of the problems we've had recently is with subs. The teachers have very well documented in their work that this child has accommodations. And this past year, a sub would not allow her to go to the bathroom when she needed. They said, nope, you've been to the bathroom way too many times. You do not need to go. So they've worked with her saying, you know, she's in 4th grade now. She's, well, 5th grade this year, that to be an advocate for herself. So her principal, teacher, and the other 4th grade teacher last year sat down with her and said, okay, this is what you can do. If a sub says, no, you can't go, you just get up, walk out, go to the bathroom, and then you find your teacher advocate, which was the other 4th grade teacher. And if that 4th grade teacher wasn't there, any of the teachers in the school said that they would be her advocate. So she would go to that classroom and say, this is what's going on. I had to leave for the bathroom. And so the teacher would go and talk to the sub. So that way she would not get penalized for walking out of class to go to the bathroom for a sub. We've also had times where during specials, they've shortened the time in specials. So they would say, well, you're not gonna go to the bathroom during PE or music. Those teachers will pull my daughter Cordelia aside and say, you can go whenever you need to. You don't even need to ask. That she just gets up and goes. This year in 5th grade, they have scheduled bathroom breaks. And what they're doing now is they can earn play money that they can use if they need to go to the bathroom on at other times. But her teacher is creating a specific pass for her that she'll just show her, and she just walks out and goes when she needs to. She has extra clothes in her backpack, or she keeps them in the nurse's office if she needs to. And when they have field trips, I often try to go, but they again keep extra clothes, and she has water bottles at school that she can have access to whenever she needs them. And as medication, she does have medication that she uses at school as needed, and she just signals her teacher and says, you know, I'm not feeling well, I need to go see the nurse, and she'll go down to the nurse's office, get her medicine, or take her rest that she needs. And then we did do state testing last year, and when she had state testing, they did remind her that if she needs a break, she can take a break. They'll stop her time and allow her to take her break before she comes back to her test. And we'll review her 504 plan every 2 years, but if there needs to be an update, we just contact the school counselor now and like, oh, this is what's going on. We need a scheduled time to update her 504 plan. And they're very accommodating in getting it updated when we need to. But just always, you know, some tips I have: be an advocate for your child. Teach your child to advocate for themselves. That's what we're working on with Cordelia, since she will be going to middle school next year, and having tons of different teachers. And her teachers in her elementary school have been very, you know, you can say, you know, this isn't okay, I need to go. And they work very hard with being that advocate for yourself as well. And don't be afraid. Like, if someone's not following that 504 plan, I've contacted the special teachers, or I've contacted the school and say, hey, this sub didn't allow her to go to the bathroom, and they'll have a meeting about it and make sure that it's being followed. I hope this was helpful, and that's all I have right now.
All right, is it my turn? Should I just dive in? Hi, I'm Rachel Peterson. Thank you for having me here. I have 2 kids. Well, one is an adult now, but both of them were diagnosed with ulcerative colitis when they were in elementary school. My son is now 19. He's had a much easier go of it and never needed a 504 or an IEP. But my daughter, who is now 16 and a junior in high school, we started this whole process, at least for the 504, when she was in 4th grade. So we've sort of had one for six or 7 years now, and updated it as needed. And I think very blanket, she goes to public schools. We're in a relatively small community. with only probably like 150 kids in her elementary school. And then the middle school and high schools are about 650 kids. So everyone knows each other. And for the most part, I found that the teachers want to help, the counselors want to help, everyone does want to help. But the flip side of that is that even though it's a small school, there's still a lot of kids, and whether it's a substitute or someone, people don't always remember exactly what the accommodations are, or what needs to be there. So this, the theme of that Tracey was talking about is like over communicating and not being shy and making sure that your child knows how to advocate for themselves, is really, really important. From the beginning, I think a lot of my daughter's seems very textbook, I think, very similar accommodations that were on the slides from Dr. David, and also that Tracey were talking about, sort of unlimited bathroom access. A lot of her stresses and things that she was worried about was privacy. Will people see me? Will people hear me? I'm going to be in there a long time. She had a lot of anxiety about that, that sort of thing, especially in middle school, which is, let's face it, not a great time for most people. So she had access to the office bathroom, access to the teacher's bathroom, access to the teacher's lounge for rest and privacy as needed, which was really mostly mentally helpful and helped her with her anxiety in a huge amount. We also had a lot, her body would go through these phases where she just would be afraid to leave the house in the morning. And so we started adjusting her schedule so that she could make it to class on time, and not be so, not be doubly worried about, now I'm missing class, now I'm going to be behind, and have that sort of snowball of anxiety as well. So we also had some of these extra time on assignments. She does need to discuss with her teachers and be really open about, I didn't have time, I wasn't feeling well, I didn't have time to do this. She extends her, she can get extended deadlines or extended due dates or extended testing time, but she needs to be pretty communicative about it. And then my tips are not particularly original either, but I think like really understand where your kids' stressors are, help them learn how to advocate for themselves. I think it's really helpful to find someone who's going to be the core advocate for your child, or at least one or two of them at the school. I found that the middle school in our community everyone was really helpful. The high school is also helpful, but there's just less so. They have other things on their minds. So I feel like we have to remind them more, or I have to push for those conversations more than I did when she was younger. I also ask the teachers like what they're observing or how she's behaving in the classroom. Part of the way we realized that she might also have ulcerative colitis like her brother did is that she would leave her fourth grade classroom and be gone for like an hour. And the teacher would be like, what is going on? And it was sort of flagged as an issue. But then we finally figured out what was happening. But being out of the classroom for that amount of time, she lost a lot of learning knowledge and instructions and classroom time. So we had to make up for that in other ways. And then also understanding what your child's biggest stressors are. Those have really evolved as my daughter has gotten older. Initially, some of it comes from just the fear of having to change your clothes or fear of having something happen where you're not totally clean any longer. And that would be horribly embarrassing. But she also now is a little bit more about, she doesn't want to disappoint her teachers. She doesn't want to seem different from her friends. Pretty textbook, but very real and visceral for them. So once you understand what the stressors are, it's sort of easier to make those accommodations. And yeah, I was gonna say a lot of her accommodations ended up being more about easing her anxiety versus helping her health or physical stuff. And then we do same thing. I think the IEP she has an IEP and a 504. That she had the 504 first and then eventually got an IEP, mostly because of the learning loss of being out of the classroom so much with infusions, and she had some hospital stuff and all that kind of thing. So we redo it every 2 years, but I get like face-to-face or voice-to-voice with people every year. And I do send a lot of emails to people on the over communication, reiterating conversations, letting people know how she's doing or how she's feeling or where we're going. I think it better safe than sorry. I'd rather have it all out there and be a little bit annoying than not say anything. So for the most part, she's doing great, and it's been very helpful. And then extra separate, that's not about 504s or IEPs. I highly, highly recommend Camp Oasis. If your child, no matter how old they are, hasn't done it, I think it was life-changing for my daughter in a very positive way. Being with people who just understood without having to talk about it has been great for her. And that's it.
Thank you both so much for sharing your stories. Now I would like to invite all of our experts and panelists to join us, and we can take questions from the audience. As a reminder, please submit your questions through the Q&A box, and we'll try to get to as many as possible. So let's see, the first question came through about accommodations for college. So what was helpful to ask for, and who did you ask for to get them in place? And so I just wanted to quickly give my 2 cents on this, just because I went through the process pretty recently. For me, when I was a high school senior, during the college app process, I was in a really big flare up. So for me, finding my accommodations was at the top of my list. So as soon as I got accepted into any university, I immediately looked up their disabilities office, or a lot of offices are disability and access, which most should have. And I reached out to them immediately to see what resources they already had in place. And so that kind of is one of the reasons why I ended up at the University of Utah, is because they immediately assigned me a counselor that was going to be specific to my case. And so she would basically walk me through all 4 years of college and help me with the accommodations process the whole time. I think accommodations are a little different between high school and college. I think there's a little more flexibility because you have a lot more freedom then, but it's a little bit harder to communicate with professors about it. So I would recommend going up to professors and introducing yourself, telling them that you do have the accommodations, and making it very clear that these are things that you need, and so that they can't blow you off for it. I think Rachel might have a little bit more input, since she does also have an older son, if you'd like to add anything.
Well, my son, he's sort of been a special case. He hasn't needed any accommodations at all. So that's annoying to my daughter, of course, but I can't add on that one. I'm sorry.
No worries.
I can share it as well.
Sure.
And to piggyback off of what you've already said so beautifully, Jackie, and Rachel, it's fantastic that your son is doing well and hasn't needed them. Like Jackie was saying, in the collegiate setting, it's either typically an office of disabilities or accommodations or access. And so would encourage you to search for the schools that you're interested in, or schools that you're matriculating to, of what is it at your particular school. Typically, there's a little bit of a similar process to the 504 and IEPs, where you do need a letter that states that you have a diagnosis and recommended accommodations and how it may impact the collegiate setting. What can be particularly nice about college and graduate school, since you can have disability accommodations in both of those settings, is that there's accommodations both for the classroom, but also for housing and for food if you are living and eating on campus. Unfortunately, depending on where the school is and what physical buildings they have, they cannot necessarily guarantee that you can have a private room with a private restroom, but we absolutely try for all of our IBD folks that we see. And so would recommend that that's written into the disability request letter. Like Jackie said, it's a little bit more on the individual student to talk with professors. When I was in college, I felt comfortable going up to professors after class to say, "Hi, I'm Jennie, I've got IBD, here's my accommodations letter. This is my disability counselor. Let me know if you need anything." It can also be a little bit uncomfortable depending on the size of the class, or if it's your first year in college. And so sometimes folks will send an email to introduce themselves and then swing by at the end, or swing by during office hours, where it might be a little bit more private. So that can be really helpful. Similar to 504s and IEPs, we really I know it's a big soapbox that I've shared as we've all been talking. We think they're tremendously helpful to have in place, even when folks are doing well. We've had some really difficult experiences with folks who didn't have that disability accommodations in place because they were feeling great and then flared, and families weren't able to get reimbursements for tuition, and there were other difficult consequences. The child still succeeded and ultimately was doing well in a college setting, but again, can be really helpful to have that in case you ever need it, even if you never do. And it shouldn't change the classes that you take or the major that you have or studying abroad or pieces like that.
The next question we have is for Dr. David. What happens when the school pushes back on your 504 request or does not provide alternative accommodations? What can parents do?
Yeah, it's a really excellent question. And it's first and foremost, it's a really difficult one when schools are not willing to always work collaboratively with us. There's a few things that folks can do. Some of it depends a little bit on where you're situated and the resources around you. So, and someone else had asked us in the chat too, I have found somewhat surprisingly that even though schools should be educating their educators about 504 plans and IEPs, I've been somewhat surprised by how many folks don't know what inflammatory bowel disease is, even folks who've been in the education system for a long time. And so sometimes having that piece of information, be it from the family, be it asking the GI provider, if you're at a center that has a social worker or psychologist, we sometimes can be uniquely suited to providing the psychoeducation about what IBD is, and also thinking about how to put it in place in the school setting. So use who you have and use who your center has, because they can be tremendous advocates and supports. There are typically consequences and ramifications for the school system and for the district if they're really unwilling to work with you and make sure that your child has reasonable accommodations. For people like myself and for many of us here, or the loved ones that we have are our kids who live with inflammatory bowel disease, these are protected under law, under that Americans with Disabilities Act. Things can sometimes be a little bit more nebulous when folks are in other school settings, like private schools, where they don't typically follow 504 plans in the same way, since that applies to public schools. There's still an accommodations process that people can undergo. All of this to say, again, use who you've got. If there's people local to you through your center, through your local CCFF chapter who can help and be resources, bringing it up to the next person, is it someone else in the school? Is it the next administrator? Someone else in the district, to make sure that your voices are heard without impacting your child. And if there's other ways that folks can help, the team is more than welcome to share my email address as well, if there's things that I can also help to problem solve folks with offline to identify some local resources. I know here in Ohio, there's a wonderful organization for the state that can essentially serve as like legal advocates. And so that can be really useful. And there might be state resources where you are as well.
The next question is for Rachel and Tracy. Who did you talk to about extracurricular activities, such as like missing schools or practices for doctor appointments?
So my understanding is that those are covered they should be covered in the 504 or can be discussed in that way as well. And if you don't have a 504 yet, I'm very pro just being as open as possible as what needs to be done. My daughter, she's a very active participant in a handful of things for a long time. And then it all kind of went the way of the dodo once the pandemic happened, and she hasn't wanted to get back into it now that we're sort of back in person. But we had a lot of open conversations with her coaches and team members also, just trying to be as transparent as possible. But I do believe if it's within the school, especially a public school, it's covered.
I agree with Rachel. It's we haven't put that in her 504 plan yet because she is in elementary school. She doesn't have a whole lot of extracurricular, but when she's been on leadership team or done Girls on the Run, I've talked to those that are the leaders of it and said, okay, this is what's going on. And they're like, oh, not a problem. If she feels up to it after her treatment, great. We'll, would love to have her here. so she, like, a lot of her things have already been outside of the school, but they've been very, accommodating, just talking to them. And I'm sure next year, once she's in middle school, we'll have those added in.
Next one's for Dr. David. Are schools required to educate the teachers and staff regarding the nature of the reason for a 504 plan, or are the parents supposed to be doing all of the education for each teacher and staff member?
So very excellent question. This can depend a lot on the school and if they've had experiences with other young folks with IBD. So while the school and the educator should be aware of what a 504 plan is and that the student is legally protected to use those accommodations, it sounds like Tracy was sharing that some folks can absolutely have some difficult experiences with substitute teachers or other folks who don't fully get it. I think one of the complexities of IBD, both from lived experience and professionally, is that we might look fine. And so it might be really difficult for someone else to see and understand. In my experience, it is best to err on the side of caution that people do not understand what IBD is and do not understand that you can't always see it / can rarely see it, and can also have a lot of urgent needs without lots of warning. And so using resources from the Crohn's and Colitis Foundation or from your local center to describe, like, this is what IBD is. It is a chronic illness. It can be unpredictable. It is real. It is not something you can see on the outside. Can be tremendously helpful. We have a young woman here at Nationwide who received special education services, and the social worker and I had a lot of ongoing conversations with the school and the family, because the school thought that her trying to use the restroom was her trying to avoid class and wouldn't let her use the restroom. And that was a significant stressor for the family. Created a lot of friction between the family and the patient and the school, which then, as Rachel was speaking to as well, the other secondary things that can happen of stress and anxiety about school, of the teacher's not going to listen to me, I'm not going to use the restroom, I'm going to have an accident. It can become a whole lot. And so it was, quite remarkable as soon as we were able to educate this school about, this is what IBD is, and, like, please have to use the restroom, and these are the other ways that we can assess for avoidance. She was not avoiding, she was using the restroom very appropriately. Then magically she was able to get what she needs. So all to say, err on the side that folks do not know, and that we can educate them about what IBD is to make sure that our kids get what they need. But schools should know about the structures of 504s and IEPs.
And I'd like to add a little to this. So we've actually been very well, like, when the teachers see the 504 plan, they do a little bit of research on their own. We have a new school nurse this year, and she's like, oh, I was actually just reading about, her accommodations. And then she was, and I did my own lookup of what Crohn's disease is and what she may need. But last year, my daughter's teacher, because the kids all started asking questions, well, why do you get to go to the bathroom so much? Or why do you miss? Like, because they all knew she missed certain days every few weeks. So the teacher encouraged and allowed my daughter to create a PowerPoint. So she created a PowerPoint and presented it to her class. This is what Crohn's is. She was, I may look fine on the outside, but this is what's going on. And this is why I have to go to the bathroom sometimes, or this is why I have to miss. And then she was able to take her school computer home. And then when we had an infusion, she was allowed to, they got together through Teams, and she was allowed to walk around and say, this is where I go when I'm gone, and showed the infusion center where she's at, the nurses, her IV, and was allowed to explain it to the children as well. But from my experience that we've had is that the teachers, once they get that 504 plan, they kind of look at, okay, what is this? Or, oh, I know somebody who has this. So they kind of have a general understanding. So we've been lucky with that. But now they're allowing my daughter to kind of explain it to others as well.
And next question is one directed towards Dr. David as well. What do you do or suggest when you're unable to make a plan for school due to active flares? The parent has no time frame or guess as to how long it'll be before their child is actually able to attend in-person school.
Yeah, that sounds like a really difficult situation. There's a few different things that we can still do when things are a little bit in flux. having an open dialogue with the school, again, with that tip of having things written as much as possible. So even if it's a phone call, sending that summary email of, thanks for talking, this is what we talked about for my child, and this is the plan of action, to at least have things in that process. Even if the child's treatment or the next few weeks and months are somewhat nebulous, having that letter from their IBD doctor saying, this is a child's diagnosis, the disease is unpredictable, can at least begin the process to have like those general accommodations in place. And then that can be refined throughout the school year and depending on what your child needs. We've run into some interesting bumps along the way for some of our young folks now, where hybrid school can be less of a thing, at least here in the state of Ohio. And so using the people that you have at your IBD center to advocate for a hybrid model. We have a young man right now that I'm helping to take care for, having a lot of really complicated experiences with his IBD. And so we're advocating for him to have virtual learning with the flexibility to come to school in person when he's feeling up to it, or even just be able to join for lunch and have that social time, be at the extracurriculars, just to be with some of his peers. So all to say, it's okay if it's just a start, but having things written down, having that letter to say that your child has a specific type of diagnosis and that accommodations that are more specific to your child will be TBD as the school year goes on, can be a helpful place to begin the dialogue and then to refine and tailor to your kid as the school year continues. And I hope they feel better much soon. Or my goodness, I hope they feel much better very soon.
And I would quickly add that when I was diagnosed, it kind of came very quickly. Like I had no symptoms prior to winter break, and then all of a sudden, I had a whole slew of them. And so I would also recommend kind of reaching out to certain teachers, ones especially that, like, I reached out to some that I felt closer to in high school, that I knew would kind of be more receptive to my situation, and understand that I wasn't just missing school to miss school, but understood that I was in pain and that I physically couldn't go. And so reaching out to them and having them kind of be my advocate there when I was unable to attend myself also kind of helped move the process along and kind of get those accommodations more in place. And so with that question, I think we're going to end the Q&A session. There was a lot of great information shared throughout this evening. Thank you to our expert faculty and panelists for sharing your knowledge and answering questions from our audience. Thank you to Takeda for their support of this program. For more information, we encourage you to check out the Crohn's and Colitis Foundation's website at crohnscolitisfoundation.org, where there are specific resources for children, teens, young adults, and parents. You can also contact the IBD Help Center to talk to a specialist about any IBD-related needs at 188 My Gut Pain. And I want to remind everyone to please fill out the evaluation survey that will be sent to you after tonight's program. We really appreciate the feedback, and it will help us plan future programming. Before we say goodnight, we would like to invite you to view the Foundation's upcoming My IBD Learning webinars and regional events at crohnscolitisfoundation.org/myibdlearning. Thank you and have a great evening.